Hey everyone, welcome back to Physiotechs. Today, we're diving into a topic that affects many of us at some point in our lives, post-surgical rehabilitation. But before we jump into our topic, if you are new on Physiotechs, please do not forget to like, share, subscribe, and hit the bell icon for latest updates from Physiotechs. Let's get started on your path to recovery and strength. Whether you've recently undergone a procedure yourself or you're supporting someone through their recovery journey, understanding what rehab entails and how it can help is crucial. First up, we have assessment and goal setting. After surgery, a team of healthcare professionals will evaluate you to understand your baseline capabilities and set personalized goals. This could mean improving mobility, reducing pain, or even getting back to work or sports. Next, let's talk about pain management. Pain can be a big hurdle, but it's manageable. Medications are often prescribed, ranging from over-the-counter options to stronger prescription meds. Non-drug methods like ice or heat therapy, massage, and acupuncture can also provide relief. Physical therapy is a cornerstone of post-surgical rehab. Early mobilization is encouraged to prevent complications like blood clots and muscle weakness. Tailored exercise programs focus on improving strength, flexibility, and endurance. Manual therapy, like joint mobilizations and soft tissue massage, can also help. Don't forget wound care. Proper care of surgical wounds is essential to prevent infections and promote healing. Nurses or healthcare providers will guide you on how to care for your wounds at home. Occupational therapy is another key aspect. It helps patients regain independence in daily activities like bathing, dressing, and cooking. Adaptive techniques and assistive devices can make these tasks easier. Nutrition and hydration are vital for healing. A balanced diet rich in protein and adequate hydration can support your recovery. Psychosocial support is often overlooked but incredibly important. Counseling and emotional support can help you navigate the emotional challenges of recovery. Family and caregiver support is equally crucial. Patient education and home exercise programs empower you to take an active role in your recovery. You'll learn about your condition, the surgical procedure, and expected recovery timeline. Home exercises keep you progressing between therapy sessions. Gradual return to activities is the end goal. For those returning to work or sports, a phased approach reduces the risk of re-injury. Functional testing ensures you're ready to take on your activities safely. Finally, continued monitoring and adjustments are essential. Regular follow-up appointments allow healthcare providers to track your progress and tweak your rehab plan as needed. Remember, recovery is a journey, not a race. If you found this video helpful, don't forget to like, share, and subscribe to Physiotechs. Hit that bell icon for the latest updates. Let's get you back to your best self. Thanks for watching. See you with next video. Till that, take care. Goodbye.